My name is Rotem Brayer, and I am an EMDR therapist, trainer, and an EMDR consultant. And my practice is in Denver, Colorado. And I'm also the host and the founder of the EMDR learning community. This is a community for EMDR therapists who are passionate about learning EMDR and learning together. I'm also the author of the book, The Art and Science of EMDR, helping clinicians bridge the path from protocol to practice, which is a guidebook for EMDR therapists who maybe finish their basic training and are a little overwhelmed by this modality and want to learn how to do it with more confidence and competence. So it's a pretty easy read for EMDR therapists. So in 2023, I launched my first cohort of my course, Psychedelic Assisted EMDR Therapy, that was approved by MGL, which is the EMDR International Association, for 12 educational credits. And I've been doing this for a while, mostly with ketamine. And so integrating EMDR with ketamine assisted psychotherapy. And I found that Bi-Tapp is by far the most convenient um, type of tapper or tactile bilateral stimulation device to work with because it's wearable and it just makes it so much easier. So I can give you a little orientation to how I do my sessions. I divide them into three segments, and I call them segments and not phases because we have the 8 phases of EMDR. And it's a little confusing if I use phases. So we have three segments. In the first segment, people are laying down with eye shades on and listening to music. And at this point, we're not using bilateral stimulation, but I put the tappers on them before not to interrupt the continuity of the session. So the first part, they're just in the journey, they take the medicine, they really, really feel it. And then the next part is the reprocessing. So this is when we use the tappers and they already have them on. And then we do what we call integration, just making sense of the whole experience. And again, having wearable tappers that, don't disrupt the session is really helpful because I've used some other tappers before and clients are in kind of like a different mind state. And I had people just throw the tappers and, it was not the best fit. And I found the wearable Bi-Tapp are really, really suited well for this kind of work. One of the things that I really like about Bi-Tapp is that the battery life lasts for a very long time. So I never have to worry about running out of battery in the middle of a session. In fact, I can charge them and then they last for a few weeks and, doing a number of sessions. And the other thing is that the tap is very gentle as opposed to, I know all the tactile bilateral stimulation devices are called tappers or buzzers interchangeably, but the Bi-Tapp, you really feel that feeling of tap on the wrist as opposed to a device that is buzzing.